Welcome to Colonie TV, the governmental educational channel for the town of Colonie. Hello and welcome to The Money Factor. I'm Richard Naylor, your host. Our guest today is Matthew Clarke from Bouchey Clarke. We're going to be talking about the Affordable Care Act. We'll get some background on it, try to simplify some of the problems, and help us all clear up some of the misunderstandings. I want to welcome you, Matt, to the show. It's great to be able to talk about this topic.
Thank you, Richard. It's a pleasure to be here today.
There's so many things we're going to be going into, limited time. Let's get a little background, though, first on your company.
Sure. We formed Bouchey Clarke Benefits in the late 90s, basically to capture, how do we put this? We saw a need for health insurance expertise in our financial clients' backgrounds, and felt that that was a good marketplace for us to be in.
And today it's become the hot topic.
Oh yeah, the Affordable Care Act is quite interesting at its face value. It's compelling and emotional from all people's perspectives. It touches everybody in one way or another. Business owners, large and small, individuals who have to comply with the individual mandate, and it definitely is affecting everybody at this point.
And it's a major seismic change, is it not, in the healthcare and the insurance side of it for us all?
Yeah, I think one of the major issues that we've been dealing with for the last year or so, trying to prepare for this January 1st, 2014 effective date of the compliant plans, is really the delivery process. In New York State and a lot of states, insurance is purchased through the commercial marketplace, where employers provide employees with health insurance benefits. This law basically has changed the dynamics of that, and through the marketplace, the insurance portal that people can buy their benefits through now, both individuals and small businesses. It's a totally different delivery process, and you don't have to be tied to a business to basically garner the lower rates that a commercial account would cost.
Now, in the past, if you had insurance, if we're fortunate to have insurance, the company you worked for generally would work all the details out, and you would take what you got. But with all the decisions that people have to make, and going on to the exchange and deciding about plans and which ones to offer their employees or which ones to buy, it seems like there's a big need for guidance. And you're a broker. I know there are other designations of types of helpers. Could you talk a little bit about that, of how people can get guidance and what is available?
Absolutely. We are a full-service brokerage. We work with clients of all sizes. We actually deliver small business benefits through 4 area chambers of commerce, which we can detail those chambers at some point. I think what the Affordable Care Act has created is a lot more confusion, a lot more touch points for the average person. And you're absolutely right. The old way was there was an HR director at a small business that was able to understand the needs of all the employees and determine what type of package they needed to go forward in that particular 12-month renewal year. That's really, I think the cost of health insurance has gotten to the point where a lot of businesses have decided either they needed to cut back on what they were providing, or they needed to provide high deductible benefit packages that there was a lot more employee engagement in. And I think this is a natural progression of that. I think one of the big, problems with the Affordable Care Act, right down to the core, is I don't believe that the average person is well prepared to buy health insurance on an insurance portal through the web. they just don't have all the tools or the vernacular or the ability to navigate their way through. Smaller businesses, larger businesses usually in New York State use a broker such as Bouchey Clarke Benefits. We're trying to get to the point now to determine whether the individual marketplace where somebody comes into our office to buy insurance is really worth our time and energy. We take pride in working with people face to face and helping them to understand what products are available to meet their needs. But at the same time, it does take a lot of time. It is very emotional, and we're just still wading through that. So, in most instances, people can use a navigator who are certified through the marketplace or the state health department to be able to provide service and help people get to their buying decision.
So a broker is different than a navigator?
Yes, correct. A broker would be a fully licensed, trained professional. A navigator really is helping the person get to a buying decision, and then they've basically cut the line at that point. A broker
and they've had what,
about
8 hours of training, not a lifetime of experience with this.
My understanding is that the navigators have gone through a five-day certification process. Okay. Brokers and agents were, I guess, given a little bit of relief based on the fact that we're currently licensed and in the state of New York to provide insurance expertise already. So we were given a one-day course, which is still a little bit light on the training side because there are so many moving parts to the law and so many issues that have to be ironed out with the law going forward.
Now, we have a New York State exchange, and as the federal government had a lot of trouble with for 36 states or so, the federal exchange, it seemed like we were doing better. But maybe more importantly, are there differences of what you're going to get when you go to New York versus a federal exchange?
Well, really, the federal exchange does not apply to New York State.
At all?
No, not at all. States were given because of the nature of how insurance is governed on a state-by-state basis, each state was given the opportunity to either develop their own exchange or they could work with a federally assisted exchange in partnership with the federal government, or they could opt out completely and let the federal government step in and their citizens could buy through the federal exchange.
Okay.
New York, I would say, has been extraordinarily ahead of the curve, and they've got some very talented people that have industry expertise, that have brokerage expertise, that have seen kind of all sides of the process from their past experience, and I think they've done a very good job, relatively speaking, to the federal government in how it was put together, how it was actually rolled out, and like anything with the complexity of computer systems and data systems, it's been extraordinarily challenging, I'm sure, from all perspectives to get the systems to talk and to make it go forward. And there's still a lot of questions that we have about how billing issues will be taken care of, and claims questions and things of that nature that on accounts that go through the exchange.
And there are a lot of changes that will still be made, and fine-tuning, and maybe even some not so fine-tuning, but I guess all those things are more complicated than we really want to get into. We just want to help people, businesses and individuals, understand maybe a few points that they were missing. So I think if somebody comes away with a little more understanding after the program, we'll be very successful.
Sure.
One of the things that we look at are the metals, as I would call them, the bronze and the silver and the gold and the platinum. Could you talk a little bit about that? What kind of a division are these for people to look at?
Yes, you're absolutely right. The compliant health plans have been, I guess, kind of simplified to the point where they've been named the metal tiers. The platinum is actually a plan that gives a person, the average person, 90% coverage expectation throughout their plan year. A gold plan would give someone an 80% coverage expectation, so their cost share would be expected to be about 20%. A silver plan would be at 70, and a bronze plan would be at 60%. And again, that's an actuarial expectation. It's going to obviously be affected by the way people use healthcare and utilize during the course of the year. But
now, we were talking before the show, and I was thinking that a 60% plan sounded awful, because if I needed a $1 million worth of medical care, and I might not be in any shape to say whether it was going to happen or not, if I'm in that kind of condition, I would be I would have to pay $400,000, which is a lot of money. If I have insurance, and I'm still paying $400,000. And you pointed out that it's really not that way.
Yeah, there's actually a new concept to most of the copay managed care types of plans, but it's been in existence for years with what they call an out-of-pocket maximum. That is a true measure of the real exposure that a person would actually have for that plan year. So an individual that's buying a policy, in any case, the maximum out-of-pocket exposure they have with deductibles, copays, or coinsurance would, once it hits $6,350 for an individual, their costs are completely covered in full by the carrier. So it's, in effect, it's like a stop loss.
Right. So it makes that gamble, if I might put it that way, or maybe just you're trying to figure the best chance that you're going to come out well, to choose whether I'd rather a 60% payment, meaning I have to pay 40%, or something high.
Correct.
So I'm trying to figure, well, how am I going to spend the least and still get good coverage?
Yeah, and one of the recommendations I would make to anybody, you have to measure what type of utilization they're going to be expecting during the course of the year. How often are they going to go to their, cardiologist, or how many prescription medications do they pay for currently? And we kind of back into some numbers that way. But typically, the best recommendation I make most often to both individuals, employees, and companies is to buy a plan that you're going to spend the least amount of premium, and maybe you come up with another way to offset that exposure, that deductible, or that coinsurance. In past years, it was much easier to predict that. The difference in premium was $2,000, and their actual exposure differential between Plan A and Plan B might have been $3,000 or $4,000. You could say, okay, how much premium is worth spending to cover that real exposure, the additional exposure of $2,000? And that's become much more muddied by the Affordable Care Act, and the high deductible plans that we really were championing for the last few years have become more difficult to get your arms around. There's a lot more cost involved, because prescription drugs, one of the 10 essential benefits that have to be baked into the base medical plans. In past years, you could buy a prescription drug writer, or you could opt out and say, I don't use prescription drugs. I'm going to expect that I won't use prescription drugs during the year. I'm going to buy a plan without them. I have 12 months where I hopefully won't use them. That was okay. Now, comprehensive drug benefits are built into the base rate, which drives the premium up. So, a little trickier decision.
So in that case, because that's part of the whole plan, the 60% might make sense for someone.
Absolutely, absolutely.
Okay.
For lower utilizers, the 60% bronze plans would make perfect sense.
So it's how do you advise someone? I mean, I think you pretty much answered the question. You're kind of, I guess, to maybe sum it up for myself, 90% would be great, but now I'm going to pay a higher premium, and it looks like the chances are I'm going to pay more overall for that year if I just look at, okay, I'm not taking any prescription drugs, and my family doesn't. So I'm probably better off not paying that, not getting that 90%.
Correct, and I think a very simple way to look at it is the more you utilize the better off you're going to be using a 90% platinum plan. The less you utilize, the better off you're going to be using a 60% or a bronze plan or something in between. I think at the end of the day, that out-of-pocket maximum benefit that's built into these plans makes it a lot less risky to make one of those decisions, going one direction or the other. And it's still, I think, at the end of the day, one of the reasons you're buying health insurance, it used to be we bought it because of peace of mind. Now there is a mandate. There is an individual mandate, so people will pay a penalty, a tax penalty, if they don't
So it really is dollars
cover
and
themselves.
cents all the way.
Yep, absolutely. And we can get into the rationale behind the penalties and whether that's actually going to work or not if we have time.
Okay, so we look ahead. This is maybe something that somebody would think. Right now, I don't need prescription drugs. We've laid that groundwork. Probably better off with a lower metal. But what if things change? Maybe some strange disease, and now the only drug that works is very expensive. Can you change your policy? Do you have a right once you've bought something, and now the future looks different?
You do have very few options to change during the plan year.
But after the year?
After the year, at the end of the plan year, you have a new open enrollment, and absolutely you can make a plan change at that time and buy something that's going to meet your needs more so at that point. During the course of the year, you may have a qualifying event like a divorce or a birth of a child or changing jobs where there's a loss of coverage. In those events, people can actually make plan changes.
Oh, that's very helpful. I would be very fearful of trying to make a decision that I'm locked into for 5 or 10 years.
Absolutely, absolutely. And again, I think the risk point, one of again, the consumer protections within the Affordable Care Act is that out-of-pocket maximum. So for an individual, it's $6,350. For a full family, which would include a two-person employee and spouse only plan, an employee and child plan, the out-of-pocket maximum is $12,700 during that plan year.
Okay, so
worst case scenario.
That's the worst case scenario,
yeah.
And hopefully you wouldn't get anywhere near that.
Correct.
There's a couple other things going on at the same time. We're going to have to decide how to approach the problem. Do I go to a broker? Do I go to a navigator? Because it is complicated. How do you approach this? Should someone go to a website, or should they go to a navigator? With all the attention in the media on the websites, and not much attention on the other options like the phone or going to someone to help you, an insurance company, it seems like that might be guiding people into doing something that they're not really capable of doing well.
Well, and I think, again, it's a fascinating time to be in the insurance business, I say to a lot of people. We are more or less in the middle of the hurricane. There are some life-changing things happening on the insurance front, on the way it's delivered. Obviously, health care is changing along the way here as well. I can't stress enough that I believe people need to use the advice of an expert. Bouchey and Clarke Benefits, we pride ourselves in delivering good answers, giving people lots of different ideas about and innovative ideas on how buying insurance can be more cost effective for themselves and for their businesses. Using a navigator if you're an individual is a great way to go. It really is a daunting process going into the exchange and picking a plan, determining what network you need to look at of providers, determining what level of prescription medication you might need, and what carriers are going to provide a formulary that fits your needs. There are a lot of moving parts, and we still don't know all the answers at this point, but I like to think that we're well ahead of the consumer in this area, and we do enjoy delivering good value and good ideas to consumers.
So that seems like really good advice. Don't just assume you have to go to the website. Get some help before you do, because you've got decisions about the amount of deductible, but you also need to keep other things in mind while you're making that decision, like the maximum that you'll have to pay, being able to change, and probably other things that we haven't touched on.
Sure. And again, I would say that what we have, we're armed with different platforms for different situations, and I think that we do a very good job delivering benefits through to our clients of all size, and generally that is based on the need of the client, and we try and meet that need depending on what platform makes the most sense, whether it's going through the exchange if you're a small business and you are able to take advantage of the small business healthcare tax credit that could help pay for up to 50% of the cost of your health insurance premiums from the business perspective, to working through one of our chambers where we provide all the administration, the HR kind of wraparound care that small businesses need, or even getting into the larger groups, helping larger groups that have the employer shared responsibility or the pay or play issues that will come to fore. In 2015, one of the pieces that was delayed, we've been giving our clients measurement guidance and helping them measure what their exposure will be, and will they be, paying penalties, or is it more cost effective to pay penalties? Some of our groups will be. So there's, again, a wealth of, or a plethora of groups that need help, and we have a lot of different arrows in the quiver.
Now, since you mentioned the chambers, how does that work with the chamber? I know that they develop plans. They work with a company to help them deliver the ability to buy health care. Why are companies doing that? I guess I'm looking for the advantages.
Well, the basic advantage is that you're offloading your health insurance administration to a professional group such as Bouchey Clarke. We work with 4 area chambers: the Fulton Montgomery Chamber of Commerce, the Southern Saratoga Chamber of Commerce, the Guilderland Chamber of Commerce, and the Rensselaer County Chamber of Commerce. And it's really a place where, if I'm a small business, I've got a lot of things going on. I'm trying to keep my business open. I'm trying to keep my employees happy. I'm trying to keep my clients happy. We like to tell them that, hey, you don't have to pay attention to the health insurance piece. We've got you covered on that. We've got your back on that. We're able to let them offload all of those decisions and give them valuable products to keep their employees satisfied, and let them do what they do best, whatever their business might be.
I had come across an article, I think it was on your website actually. There are articles all over the place though.
Sure.
Some people are doing better with the Affordable Care Act, and some people are not. Obviously the goal of the Affordable Care Act was to bring many, many more people who might have been going to the emergency room into the insurance market to try to broaden the pot, right? But some people are finding that they actually are worse off. What kind of person might that be? Like sole proprietorship?
Sure.
And how should they approach this?
Well, there's been a, I guess, kind of a compression of rate structures through this process of, providing benefits through the metal tiers, as we talked about earlier. What's happened is, with some of the individual tax credits for an individual that's buying, which are called the advanced premium tax credits, for somebody that's buying coverage through the exchange, their premiums could be going down significantly. They may have only had access to very expensive direct pay plans through the local carriers. By all estimates, those prices have come down about 50%. There's really 3 buckets of people. That's one bucket. That represented about 29,000 people in the state of New York. You have another million or so that were covered by government subsidized programs like Medicare, Medicaid, Healthy New York, things of that nature. Then you've got the commercial marketplace. The marketplace where we work day in, day out is that small group area, large group area. Those companies,
which one of those?
The employer groups, commercial
the 20,
insurance.
not the 29,000.
No, that's probably 15 million or so of the marketplace. You know, when I say marketplace, the population of the state that are insured through those plans. That side has probably been affected the most adversely because some of the plans, again, have been taken away to meet these compliant bronze, silver, gold, and platinum.
And for example,
plans.
they have to have drug coverage.
They have to have drug coverage when in the past they weren't mandated to provide those types of benefits. You know, pricing has increased almost 300% for some of these high deductible plans that I alluded to earlier, and people were starting to really get a good feel for the high deductibles and understanding their true exposure to a health plan versus a managed care plan that they kind of pay as they go, and they're paying a high premium to the insurance company, and whether they use the services or not, they're still paying that premium month in, month out. So the high deductible plans were very heavily impacted from a rate perspective by the Affordable Care Act, and there are still a lot of strategies that we employ to keep those prices down, try and find different markets, try and reconfigure the way the employer may be contributing towards the plan, and come up with, you know, cost-effective ideas. It's been a challenge. I'll tell you that. It's been a challenge for every business client we have.
One of the, I guess, the controversial aspects of it is or maybe just the difficulties that people are having, is with networks. Let's say the anesthesiologist isn't in the network, but the surgeon is, and how do you coordinate the hospital, and what if I'm not in New York, and could you go into some of these issues? How can people think about it when they want to buy a plan? Are there differences in plans by the size of the network?
Yeah, the network is probably one of the hottest topics in our world right now. I actually audited a Senate hearing yesterday down at the state capitol where Donna Frescatore, who heads up the exchange for the health department of the state of New York, was basically testifying to the rollout of the state marketplace and the exchanges. And the majority of the questions that I heard to her were about the network and how much care and time and energy was spent around that. I think it's again, I use the word daunting, to try and put together all the hospitals and all the providers, whether it be a cardiologist or a podiatrist or a chiropractor or an anesthesiologist. It's very, very difficult in a free marketplace. You know, these providers have typically been contractors on their own. They're small businesses themselves, and that's changed a great deal from the Affordable Care Act's inception. But I think the network piece is going to continue to evolve. I think you really need an expert to help you mine through the plans, what's available.
And can you see who's in the network so that you make sure?
When you're actually on the New York State portal, you cannot see the network when you're looking at products. Basically, the product formula is going to show you the coverage and the price. To determine what network is provided with your particular choice of product and the prescription drug formula, you'd need to go to the carrier's website,
okay,
which makes it all that much more cumbersome a process.
But it's an important step.
Absolutely, absolutely. And again, I would advise people to seek out trusted advisors like brokers or the state-based navigators.
Anything else with networks that we might be able to help people with?
Typically, it depends on the carrier, and we're still trying to figure that out. And again, at this hearing yesterday, they were talking about providers that were listed in a carrier's networks on their websites that were no longer practicing,
Right.
were dead, were in another state at that point. And I think it's just the volume of data that's out there, and you really do have to ask a lot of questions. And I think ultimately that's really going to be the make or break of the Affordable Care Act is personal engagement, people really learning, to kind of sum this up, people learning more about their health plans, not counting on an HR, human resources administrator in their business that they might see once or twice a year, really studying this, listening to good advice from a broker or a navigator, seeking out more information on the internet, and trying to become a better healthcare consumer. That's going to drive pricing down because people will use less. They'll use when they need to and not run to an emergency room or run, when they have the sniffles. There's going to be more cost share, and people will find ways to save money if it's their money.
Now, how does this match? How does this work in with Medicare? Does it at all?
It's more. There's more moving parts with Medicaid than Medicare at this point. Medicaid has been expanded by up to 130%. I'm sorry, 138% of what it was prior, which means more people at lower incomes are being covered by Medicaid, which means that there's more subsidies available for folks that are going in to buy their coverage through the marketplace.
So is 45,000 is that a number that, am I remembering that right?
Yeah, 40 it's between 45 and 50,000. I can't remember the exact, it's 48.6, I believe. That's where the subsidy line has been drawn.
And that's a family income?
That's single income.
Single income.
400% of the federal poverty level. And that's where that number lands in the high 40,000s.
Okay.
That's where a subsidy is available to help someone offset their premium.
Okay.
And it's called the Advanced Premium Tax Credit. Those subsidies start to dwindle if somebody goes, above 32, 35,000, they start to get less and less, obviously.
We do have a lot of jobs that are in the 20s and 30s.
Oh, sure. And I think in listening to some of the numbers I've been digesting in the media and through our resources, probably almost 35% of the people that have gone through the exchange process and bought insurance have garnered a subsidy and are actually eligible for Medicaid.
And those are actually the ones who are more motivated to use the exchange,
sure.
I guess. But maybe the ones who would have the most difficulty using it.
Yeah, they may not have access. They may not have access to a computer. They may just not have the educational background to be able to understand all the vernacular. We have professionals day in, day out that call us and are clueless about all the different acronyms that we use. And it's one of the challenges I face every day is trying to talk in a down-to-earth manner that doesn't complicate it that much more for the client.
So the tax credit and the offsetting, how many businesses would that affect? Let's say you have, what is it? If you're under 50 or under, you can use this and set it up using the exchange. Is that right?
Yes, you can actually use the marketplace for the shop exchange, which is the small business health plan options exchange, with 50 or fewer employees. The tax credit, the small business tax credit that's applied for small businesses actually begins at 25 and lower.
Okay.
So if you have 25 or fewer employees, you can actually potentially garner that.
And that's a lot
credit.
Of businesses.
Absolutely. There are other parameters is they need to have an average income of less than $50,000, excluding the shareholders or owners of the company. And the company needs to provide at least 50% of the premium in a contribution for that employee. What we found is that, after $25,000 of average earnings and 15 employees or so, that tax credit starts to really go away and vanish. So really you're affecting 10 to 15 lives or lower eligible employees and lower income groups, which not-for-profits can actually get a payroll tax credit applied up to 35%.
So,
but it could be a significant subsidy.
And these are questions that people would really need to ask an expert. But how is the money, how is the cost break given to the individual? If you're part of a group, it's not really a group anymore. What is that if it's 15 or 25 people? Are people paying individually and they get offset money, or the company sets up something and they get offset, and that's how they set the rate?
Yes. So a company, let's take a theoretical company that is applying for benefits through the shop exchange. They're going to give us a listing of the employees with salary, with male-female data, some different census data. We're going to plug that into the exchange. We're going to help that company determine what their contribution will be for the plans.
Okay.
And then a system email is generated to the individual employees. Those employees know now that they're going to be offered plans through the exchange, and that employer allows, they're the ones that determine through our guidance which plans make the most sense for their employees. And then that contribution amount or that credit towards the employee's coverage is applied for that employee, and they can go in and pick a plan and have their premiums offset by the employer contribution. Obviously, a lot of moving parts to that. You need the employee to be engaged and understand all the plans. You need the employer to engage and make sure that they're aware of how this all works. And
so that group needs a lot of education, and that's why it's hard to work with an individual or a family. It's hard enough to get a proprietor to understand, and then you've got a whole group to pay for that.
Right. And I think, again, one of the strengths of our business is that we do a lot of counseling. We do a lot of face-to-face work with the employees. We hold their hands, so to speak, and I don't like that to sound demeaning, but people need a lot of hand-holding when it comes to health insurance right now.
Are there any issues in terms of families? Now, the typical model with I guess before now is under the Affordable Care Act, but back in 2012 or earlier, if one of the family had a good policy from their employer, they might go with a family plan. They might think, well, we'll both go with an individual plan, or we have a big family and that would be better. Has that kind of thinking had to be changed a little bit under the Affordable Care Act?
Yes, that's actually an excellent question. A lot of employers, large employers, national employers, have been proactive with the Affordable Care Act and have come out with completely new contribution strategies whereby they may have been able or been willing to contribute towards a spouse's plan or a spouse's coverage or the children's coverage. Now they're less likely to do that, and now they've kind of changed the whole contribution strategy. Smaller companies still in a large marketplace we're working with them day in, day out this time of year to prepare for 2015 when they will have to prove that they're covering their eligible employees. And there's actually a lot of calculations that try and help them determine what's an eligible employee, and that's changed a great deal.
And it's a full-time employee, meaning 30 hours or more, right? 30
hours or more for federal Affordable Care Act purposes. Back to your question about the families, what's happening now is people have always been wise to how much they're getting paid for by their respective companies, one employee and a spouse, or two spouses that have different employers. they have to drill down and do some budget crunching to figure out which plans, they may have to split their plan up now more effective and more effectively approach it from a cost perspective. So it really depends on the employer contribution, ultimately.
I think we're about at the end of our time. I'm not sure what I might have left out. I know that there are so many details, but I think what you provided is really excellent, and I've learned a lot, so I'm assuming other people would have also.
Good. I would say, in summary, that it's a daunting change for just about everybody, as we talked about earlier. It's affecting individuals, it's affecting small businesses, it's affecting large businesses, and all their employees. There's impacts throughout.
And we're doing it in real time.
Yeah,
that's the scary
it's
part.
happening right now, and it's a very emotional topic. I think one of the things that we help provide is a calming, influence. We try and help people really understand what they've got from a plan perspective, how much exposure they have going forward, from an insurance perspective, and really how we can help them better utilize their plans, and get more if they're an employer, help them get more employee satisfaction from what they're paying for their employees, and ultimately we all have to become better healthcare consumers, and we all have to think healthier, and I think you could have another whole program on wellness, and how that's going to be impacting the Affordable Care Act in a lot of ways.
Maybe we will.
Sounds great.
Thank you so much, Matt.
Thank you, Richard. Appreciate it.
And I want to thank you for watching. I hope you enjoyed the show, that you learned something about this very complicated area, and that you have a great week. Take care. Welcome to Colonie TV, the governmental educational channel for the town of Colonie.